Okay, wonderful. I know we have folks who will be joining us, but I'm just going to go ahead and get us started. I want to say hello and welcome to all. I am Kim Nitz with the Parkinson's Foundation. I've got my colleagues Krista, Danielle, and Elizabeth here today, and we are all grateful for this opportunity to reach our care partners of veterans living with Parkinson's. We want to respond to the many questions that we receive about caregiving benefits and resources that are available to you. So today we're collaborating with VA experts as well as a care partner of a veteran to specifically address those questions. Today's format will include two presenters from the VA, followed by a care partner. We will be recording this segment of the program, the presentation portion, and then we'll share that recording back with you probably next week if there is anything that you'd like to go back and watch. During these presentations, we do ask that everyone stay on mute to reduce any background noise. Following the speaker presentations, we will open up the program to take your questions, and we'll stop the recording at that point, just out of respect for your privacy. We do ask we try to keep questions today to a more general nature and of interest to a broader audience. If you do have questions of a more specific nature, we'll provide a number of resources and contacts of who you can reach out to. Due to our great turnout today, we're going to ask that you submit your questions through that same chat button at the bottom of your Zoom screen. That way our team can collect those and we'll get back to all that we can today with a response. Please note, we do have a lot of material to cover, and our question and answer session possibly may take us a little bit past our 1 hour mark, but our speaker has graciously agreed to do that. So very quickly, I would like to share a bit about the Parkinson's Foundation. We are a national organization working to support the estimated 1 million Americans who live with Parkinson's disease, as well as the many like you who care for them and those working to end the disease. We focus on 3 goals, which are advancing Parkinson's research, improving care for those living with Parkinson's, and empowering the Parkinson's community with educational resources. These resources are extensive and include a collection of fact sheets, podcasts, books, our newly diagnosed kit. Just as an example, and you'll see behind me as well, this is our Caring and Coping book that is free to download or order. We do have a life-saving hospital safety kit called the Aware and Care Kit. And of course, our toll-free helpline at 1-800-4PD-INFO, which is staffed by Parkinson's specialists. We also encourage you to learn more about PD Generation, which is a national research initiative providing genetic testing for PD-related genes and genetic counseling at no cost in both English and Spanish. You can visit parkinson.org/PDGeneration or call our helpline. Also, we recognize that an estimated 110,000 veterans are living with Parkinson's disease. And last year, the Parkinson's Foundation formed a relationship with the U.S. Department of Veteran Affairs to bring more access to education and resources for our veterans. We'll continue hosting a series of online educational programs for veterans, as well as offering many online resources and the FAQ document that you see here, which is available at parkinson.org/veterans. We thank your loved ones for their service and are honored to support you on this Parkinson's journey. I also hope all of us can take a moment to recognize this is November and it is National Family Caregiving Month. So this month we remind care partners about the importance of caring for yourselves while caring for a loved one with Parkinson's. We have some great resources for you to explore at the link that you see on your screen, as well as personal stories, discussion forums, and free care partner courses. We want to thank REQUIREMEN for their generous sponsorship to help us reach more care partners with resources, including programs like this one. And so now I am pleased to introduce today's speakers. First, we've got Gretchen Glenn. Gretchen is an LCSW who has served as a social worker and Associate Director of Education for the Philadelphia PADRECC since 2003. Ms. Glenn focuses her practice on adjustment to chronic illness, supportive counseling, and community outreach for veterans and families diagnosed with Parkinson's disease and other movement disorders. Ms. Glenn also serves as chair of the National VA Parkinson's Disease Consortium Education Subcommittee, which is responsible for providing educational opportunities to national VA healthcare providers regarding the care of veterans with Parkinson's disease. We also have Kellee Taylor joining us. Kellee is an LCSW and is the Caregiver Support Program Manager for the Philadelphia VA Caregiver Support Program. She began her career with the Department of Veterans Affairs as an intern in 2008. She received her undergrad degree from Temple University and her graduate degree from Widener University. Kellee has been a member of HUD-VASH, Outpatient Mental Health and Suicide Prevention Team at the Corporal Michael J. Crescenz VA Medical Center in Philadelphia. Kellee is the wife of a combat disabled veteran, Brian, who ignited her passion for veteran-centered care. Kellee has one daughter and one fur baby. And Kellee actually will not be able to join us for the Q&A session today, but she will be sharing a lot of great information about the caregiver program. So I'll turn it over to Gretchen now to share her slides, and we'll go from there.
Okay, just 1 second. It's in presentation mode. There we go. Are you able to see the slides? Or am I not sharing them?
Not yet.
Not yet.
Sorry about this.
Not a worry at all.
In our practice.
Of course. It's all good. Hopefully everyone take a drink of water and get comfortable.
All right, let me. My Zoom isn't popping up now. Oh my gosh.
Gretchen, try hitting escape on PowerPoint so that you can get out of full screen mode and see if that helps.
Making me rejoin the meeting. Oh, you gotta love technology. There we go. Okay. Cancel.
Yeah, and Gretchen, if
Here we
it
go.
doesn't, okay. We're also happy to share. Oh, there you go.
Okay, sorry about that. Thank you, Kim, for the introduction, and thank you for having us present today. I want to first recognize.
Sorry, Gretchen. I'm sorry for interrupting. Do you mind if you go to the top left-hand side where it says display settings?
Display setting?
Yep, do you see that somewhere? We see your notes, that's why I wanted to just switch over the screen. All right, we'll try one more thing. And then, okay, so do you see on the top side, on the right, display settings right next to it?
I don't have a display setting.
Okay, no worries. Let me try one more thing. I'm going to stop your screen share and try to hit share screen one more time. And then if we cannot get it to work, we'll have my colleague Krista share the screen for you. So we'll try this one last time.
How's that?
That's perfect. Thank you so much.
Okay. Sorry about that, everyone. I'm still getting the hang of the technology. So first, I want to recognize, honor, and thank all of the care partners that are on this webinar who devote yourselves to caring for your loved one. Just know that you are a valued and important member of your partner's treatment team, and we appreciate and value all that you bring to the table. So today I'm going to review who the PADRECCS are, our consortium center network, and the care we provide. And then we will have Kellee Taylor present on the VA Caregiver Support Program. So just a little overview of what we're going to talk about. So the Parkinson's Disease Research, Education, and Clinical Centers, also called the PADRECCS, were developed in 2001 by the Department of Veteran Affairs to revolutionize services for the then approximate 80,000 veterans afflicted with Parkinson's disease. This number has since grown to approximately 110,000. Each PADRECC is designed to deliver state-of-the-art clinical care, pioneering research, and educational programs to an expansive geographic region. All the centers are staffed by internationally recognized movement disorder specialists and researchers. And the 6 centers are located at the Philadelphia, Richmond, Houston, West LA, San Francisco, and then we have a split center in Portland and Seattle Medical Center. So you can see on this slide, the PADRECCs are represented by the red dots, and you can see each PADRECC service area is highlighted as well. So as you can see, we create sort of a necklace, what we refer to as a necklace around the country to provide all veterans with movement disorders care. So you can see that's a would be difficult to reach veterans who are more in the middle of the country to get to one of the PADRECC sites. So in response to that, in 2003, the PADRECCs introduced the National VA Parkinson's Disease Consortium in an effort to promote Parkinson's disease awareness across the VA healthcare system by providing professional networking, mentorship, and training opportunities, and is comprised of VA physicians, nurses, pharmacists, social workers, physical and occupational therapists, and other allied health professionals who have an interest in Parkinson's disease. We then launched the Consortium Center Network in 2006 to broaden the impact of the PADRECC mission to be able to reach more veterans across the country. These designated centers offer veterans convenient access to specialized movement disorder services within all of the VISN, what we call the VISN, the Veterans Integrated Service Networks. So all of the centers are staffed by movement disorder specialists or clinicians with vast experience or interest in the field of movement disorders. And together, the 6 PADRECCs and over 50 consortium centers are able to provide convenient and state-of-the-art care to veterans throughout the country. So we created what we call a hub and spoke model of care. In 2020, the PADRECCs were fortunate to form a partnership with the Parkinson's Foundation. And as you can see from this map, many of the Parkinson's Foundation Centers of Excellence are close to VA PADRECC and or consortium sites. So you can see that the PADRECCs are represented by the green dots. The PF Centers of Excellence are represented by the blue dots. And then the VA Consortium Center networks are the orange dots. So as you can see, we were able to fill in several of those gaps, meaning that if a veteran is unable to travel to a PADRECC for care, we can locate and find a consortium site that's might be closer to them and easy, more accessible to be able to refer to them, to refer the veteran to for care. So the PADRECC has 3 missions: clinical care, which is we have a multidisciplinary team approach that consists of, as I said before, neurologists, nurses, nurse practitioners, social work, speech language, pathologists, physical occupational therapists, etc., pharmacists. We also have an education mission, which is part of what we're doing today, which is providing patient, family, and professional programs to educate people with Parkinson's, as well as professionals and clinicians within and outside the VA on Parkinson's disease care and treatment. And we also have a robust research component to our mission. Some of the patient education services that we offer is monthly virtual support groups that most PADRECCs provide. I will note, before COVID, most of us were having in-person groups, and that has since changed. And I think virtual groups will be here to stay, as well as maybe hopefully one day getting back to in-person groups. But it has really allowed the opportunity to expand access to group offerings for our veterans. Annual symposiums. And we have a variety of print and media resources available on our website, which you can access at this link below. So how do you know if you're eligible for care at a PADRECC or a consortium center? So first, a veteran must be enrolled in the VA healthcare system to receive care at a PADRECC or a consortium center. You can choose a PADRECC or a consortium center you would like to receive care at, and you can go to our Getting Care page on our website to check out the listing of the PADRECCs and the consortium sites and where they're located at. You can ask your VA primary care provider or VA neurologist to make a referral to a PADRECC or Consortium center, or you can self-refer by calling the PADRECC or Consortium center directly. We also have a robust telehealth program to provide movement disorders care to veterans who are unable to travel to a PADRECC or a Consortium center. And you can always call the PADRECC or Consortium hotline at 1-800-949-1001 and the extension 205769 if you need assistance with this process. I'd just like to mention that the FAQ that you were given earlier by the when you registered has all of this information and contact information as well. So how do you know if you're eligible for VA healthcare? So a veteran may be eligible for VA healthcare benefits if he/she served in the active military, naval, or air service and did not receive a dishonorable discharge. If you're a current or former member of the Reserves or National Guard, you must have been called to active duty by a federal order and completed the full period of which you were called or ordered to active duty. If you have or had active duty status for training purposes only, you may not qualify. You do not qualify for VA healthcare. So there is eligibility criteria that you need to meet, but you can check that out on the VA eligibility website, and you can even apply for VA healthcare there as well. So now I just want to talk a little bit about the PADRECCS and the Parkinson's Foundation Centers of Excellence and how we are working together. So veterans who are eligible for movement disorder care at a VA do not need to give up their community neurologist. And this is a question that comes up often. Oftentimes veterans may have been seeing their community neurologist for many years, have a relationship with them, and are reluctant to give that person up or come to the VA and thinking that they have to give that neurologist up. And that's not the case. We do what we call co-practice, and it's very common. So the PADRECCS and the PF Centers of Excellence work together to ensure veterans are receiving the best possible care with access to eligible benefits. Veterans who already have a community neurologist, again, can choose to have that neurologist manage his or her PD care and come to the VA at least one time a year to maintain VA benefits. So that means access to the prescription, the pharmacy benefit, durable medical equipment, some in-home support programs. As long as you come to the VA one time a year, you can maintain those benefits. We do ask that you choose one neurologist to be your director of care. So we don't want two neurologists making changes to your treatment plan, but they can work together to manage that together. Also, several PADRECCS partners with the Centers of Excellence to provide fellowship opportunities here in Philadelphia. We share our fellow trainees with the University of Pennsylvania. We also collaborate on a lot of patient education programs together. I do a lot of work with our area university sites, and several PADRECC attendings have appointments at the University Centers of Excellence. We also do collaborative work with research as well. So we're not in competition with each other. We really want to work together to make sure that our patients are receiving all the care that they're eligible for and that would be helpful to them. So before we move on, I just want to go over some important VA lingo. We have a lot of acronyms and terms that we use, and one important one that comes up often is what does service-connected and non-service connected mean? Veterans who are service-connected refers to veterans who are disabled by an injury or disease that was caused or aggravated by military service or occurred while serving in the military. Parkinson's disease is a presumptive condition for some veterans, which means that it's presumed that the disability or the Parkinson's is caused by military service if served during a specific wartime and or exposed to certain toxins. Veterans who are service-connected receive a disability compensation, which is a tax-free monetary benefit, and the amount of compensation is determined on the level of disability. And if you're service-connected, you would be eligible for VA healthcare benefits. Non-service connected status refers to veterans who have a disability or health issue not related to their military service. So veterans diagnosed with Parkinson's who do not meet the criteria for a presumptive service connected condition may be eligible for some VA benefits under the non-service connected status, and typically there is an income limit for that. And that also has a tax-free monetary benefit payable to low-income wartime veterans. Veterans who are eligible for a pension and are housebound or require the aid and attendance of another person may be eligible for additional monetary amounts. So where that comes into play, and just to tell you a little bit about Agent Orange and other toxin exposure. So when the PADRECCS were first established, Parkinson's disease was not a service-connected condition. But in 2010, it became a presumptive service-connected condition for those who served in Vietnam era and were exposed to Agent Orange. It's recently have been expanded to include the Blue Water Navy veterans, as well as some areas in where Agent Orange was stored. Oh, sorry, my slides skipped around on me. Sorry about that. And also, it's for veterans who were stationed at Camp Lejeune during 1953 or 1987, can be considered having a presumptive service-connected condition related to the water contamination. And most recently, in May of this year, the VA added Parkinsonism to the list of presumptive service-connected conditions associated with Agent Orange, which is really a big deal for us, because for many years it was difficult applying for service connection for some of our Parkinson's patients who the diagnosis was still unclear if it was idiopathic Parkinson's disease versus Parkinsonism. So now we no longer need to distinguish between that if the veteran was exposed to Agent Orange. So you can learn more about these through these links that are published here, as well as in the FAQ document that you received. So now that I've given you some background on the VA PADRECC, the Consortium Center Network, eligibility for VA healthcare, as well as Parkinson's as a presumptive service-connected condition, now we'll go over some of the care partner resources available via the VA. As we know, responsibilities vary throughout the course of the disease. In early Parkinson's disease, it can be more emotional support, accompanied to doctor visits. But as the disease progresses, caregiving responsibilities can move towards more hands-on help and be needed on a more regular basis. And this can lead to care partner burnout, fatigue, which is when help in the home can become most beneficial. So I'm not going to go into great detail on some of these benefit resources that we offer, but VA offers a variety of medical care and support services and programs for veterans, several of them being of particular interest for veterans with Parkinson's disease. Some of the benefits are based on level or percent of disability. Depending on service connection or income, there may be a copay for some of these programs. And I'd just like to note that each VA medical center offers these programs to some extent, but how they are run and eligibility criteria may differ from each VA. So it's important to connect with your VA social worker to determine what benefits and programs might be available to you and for your specific case in terms of what you might be eligible for. So some of these programs, and this is not an exhaustive list, there's primary care services, including pharmacy benefit, mental health care, rehab services like PT, OT, and speech, some contracts with adult day care programs, home health aid to help with hands-on personal care, respite care services to give caregivers a break, home-based primary care program, which for veterans who are unable to travel to the VA, there is a radius of usually about 30 miles from a VA you have to live. If you're over that, you may not be eligible. But that's for veterans who really can't leave their home anymore. We can bring primary care to you, hospice and palliative care, a lot of durable medical equipment. If living at home is no longer an option, there are some veterans might be eligible for VA nursing home care, as well as caregiver support programs. So who can help? VA social workers can assess your needs and make you aware of the availability and eligibility of services and help advocate for you. So if you're already in the VA healthcare system, you should have a social worker that works with your primary care team. I encourage you to make a connection with that social worker just to have an assessment done to see what you might be eligible for or what programs might be available to you when you need them down the line. VA veteran service officers can help applying for or increasing VA disability benefits. So this is applying for that service-connected benefit. They can help with the process, help you with the process, which can be complicated and sometimes overwhelming. And they can also monitor your claim and advocate for you. So the veteran service officers really work on the benefit side of things. The social workers work more towards the healthcare benefits. So now I'm going to pass this off to my colleague, Kellee Taylor from the Philadelphia VA Caregiver Support Program Manager to tell you more about her program and resources available. Kellee?
Good afternoon, everyone. Thank you, Gretchen. That was wonderful. She gave a wealth of information, and I learned a lot, so I appreciate you greatly. Again, my name is Kellee Taylor. I'm the program manager for the Philadelphia VA's Caregiver Support Program. And the CSP mission statement is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. Next slide, please. The CSP is made up of two different programs. The first is the program of General Caregiver Support Services. This is our program where all caregivers are welcome to receive training, education, support, self-care courses, socializations with other caregivers. This is our umbrella program that pretty much houses all of our great education and training. The second program is our comprehensive program. And this is a program that provides a monthly stipend, beneficiary travel, mental health counseling, and enhanced respite services and other benefits based on being accepted for the program. Next slide, please. The comprehensive program, the initials are PCAFC, that stands for Program of Comprehensive Assistance for Family Caregivers. This program provides family caregivers of eligible veterans with certain benefits such as training, enhanced respite, counseling, technical support, beneficiary travel, a monthly stipend, and healthcare if qualified through the Civilian Health and Medical Program of the Department of Veterans Affairs, known as CHAMP VA. Next slide, please. This program has expanded. As of October 2020, the PCAFC eligibility expanded to include eligible veterans who incurred or aggravated a serious injury in the line of duty in the active military, naval, or air service on or before May 7th, 1975. Previous to October 1st, 2020, the only veterans that was eligible for the program were those who incurred injury after 9/11/2001. Next slide, please. So the eligibility requirements for the PCAFC is to be at least 70% service connected. And this can be a single disability rating or a combined rating. The service connection, as I alluded to before, must have occurred on or before May 7th, 1975, or on or after September 11th, 2001. Additionally, the veteran must be in need of personal care services. This means that the eligible veteran requires in-personal care services from another person, and without such personal care services or alternative caregiving arrangements, including respite or assistance, that this would need to be done for the veteran's safety. So that's a really fancy way of saying that this person is dependent upon another for their well-being and safety and the performance of their ADLs. Next slide, please. ADLs, how does the VA define veterans' inability to perform an ADL? The 7 ADLs that we're looking for under the final rule is dressing or undressing oneself, bathing, grooming oneself in order to keep oneself clean and presentable, adjusting any special prosthetic. Can you go back, please? Adjusting any special prosthetic or orthopedic appliance, toileting or attending to toileting, feeding oneself due to loss of coordination of upper extremities, extreme weakness, or inability to swallow, or mobility. And for these ADLs, what changed with the final rule is that for these ADLs is dependency every time the ADL is completed. Next slide, please. How does the VA define need for supervision, protection, or instruction? Under the final rule, this means that an individual has a functional impairment that directly impacts the individual's ability to maintain his or her personal safety on a daily basis. This definition focuses on functional impairment instead of symptoms or diagnoses. So what that means is that families based on diagnosis will say, hey, this person is diagnosed with this. I'm going to apply for the program. In our program, we're not looking from a diagnostic perspective. We're looking at impairment and not symptoms. So based on that person's inability to keep themselves safe as reported within the medical record and self-report. Next slide, please. How does the VA define unable to self-sustain in a community? The VA will consider unable to self-sustain in a community to mean that a veteran requires personal care services for at least 3 or more of the 7 ADLs listed in the definitions, or has a constant need for supervision, protection, or instruction on a continuous basis. Next slide, please. The second phase of expansion, as said earlier, right now, veterans are eligible that were injured before May 7th, 1975, and after 9/11/2001. The second phase of expansion will happen October 1st, 2022, to include the veterans who served that were injured between May 8th, 1975 and September 10th, 2001. Next slide, please. How can I apply for the PCAFC? You can go to the website, which is www.caregiver.va.gov, or you can download the form and you can mail it to Atlanta. The address will be shared with you guys as well. Next slide, please. The CSP application process. This is a comprehensive and robust application process from a multidisciplinary team at your local VA. There are several steps. The first step, once receiving the application, a member of your local team will call you, they'll introduce themselves, and they're going to go through the criteria that we discussed previously. They're going to actually explicit questions to make certain that the veteran is qualified based on time of service and service connection, and they're going to make certain that you, as the family caregiver, is a part of the veteran's family as defined by the VA. In the VA, a family caregiver is someone who is married or related by blood, or lives with the veteran. So that caregiver team, local caregiver team provider will call you and make certain that's so. If it's not, then the application will end at that point if you and the veteran aren't eligible. If it is, if everything is answered affirmatively, you will move on to the assessment portion of the application process. There will be a psychosocial assessment given to the veteran and the caregiver, and then the veteran will actually have what's called a functional assessment, where a clinical assessor will meet with the veteran and assess the veteran's ability, functioning ability in regards to ADLs and ability to keep oneself safe. Once all those assessments are done, your local team will send it over to what we call the VISN seat, and seat stands for eligibility and approval team, centralized eligibility and approval team. And that's a multidisciplinary team who will take a look at all the assessments that have been completed of the veteran and the caregiver, and also the medical records that are available. And that's an important part of the application process. The assessments won't stand by themselves. We'll utilize the medical records to be able to support the need for personal caregiving. And that goes back to what Gretchen shared with you earlier. In our system, the primary care provider is the source, the point and the source of referral within our system. So when you're applying for any type of services within the VA, that one visit a year will be with that person who will make certain that they examine and provide all the necessary external records that you might have and place them on our VA medical record for any type of evaluation or eligibility for various programs. If the veteran is found to be clinically eligible for the program, the caregiver will then participate in either a virtual, in-person, or at-home training. Then once the caregiver has passed that training successfully, there will be an in-home assessment with a clinical assessor with the goal of further evaluating the clinical appropriateness of the veteran and the caregiver and the safety of the home as well. And then those assessments in the caregiver training is sent back over to the SEAT team, and they will make the final determination as to the appropriateness of enrollment into the caregiver program. Next slide, please. The monthly stipend that you can receive is based on the area that you live. We utilize within the federal system called the GS, the general schedule, and caregivers will be compensated at a grade 4, step 1, based on locality. So you'll notice that in this slide, I don't put an amount because it will be based on where you live. There are 2 different levels within the caregiver program. The first is level 1. Level 1 is typically the veteran has been assessed to either need assistance with ADLs or assistance with keeping one safe. Level 2 is typically a complete dependency in regards to ADLs and or inability to keep safe. Next slide, please. The Program of General Caregiver Support Services is the program that we spoke of earlier. This is the program that is not based on eligibility in regards to service connection, in regards to clinical threshold. This is the program as you as a care partner of a veteran can interact with VA staff and being educated, receiving training, being linked up with other caregivers for support. And also very important, a very underutilized service is actual accessing mental health services for the caregiver as it relates to the caregiver. Excuse me, to the veteran, I apologize. So if you're meeting with a provider in the VA and you share with them that for whatever reason you're having any type of adjustment disorder in regards to your responsibility as a care partner, they will send over a referral to your local caregiver support team and you can actually receive access to mental health treatment, as long as the veteran is enrolled in a VA healthcare and consents to the designation and participation of the assigned caregiver. So that would mean that, as we said earlier, that if the veteran is enrolled, and then we would meet with you and the veteran would give permission for you to receive the services and participate within our program. Next slide, please. PGCSS provides education, support, and training to successfully care for the veteran and themselves. We meet this need by providing coaching, skills training, group and individual interventions, peer support across multiple modalities. Currently, we're doing a lot of virtual things, but we do provide telephone, virtual. Since the pandemic, we're not doing as much in person, but hopefully once things settle in a little bit more, we'll do a little bit more in person, but definitely telephone and virtually right now. And also there are some courses that you can sign online that you can utilize and self-guided at your own pace. Next slide, please. The available supports that are available nationally are coaching via Reach VA, training, suicide prevention training specifically for caregivers, building better caregivers, caregivers first. These are all trainings that these are evidence-based trainings that show caregivers and expose them to various skills, trainings specifically for various diagnoses. We don't have one specifically for Parkinson's now, but there are other diagnoses and a blanketed caregiver training that can be utilized for any caregiver of any diagnoses. As far as group interventions, we provide self-care courses, Reach VA, and I know at our VA in Philadelphia, we have a plethora of self-help and training and educational courses based on diagnoses, various interests, and just fun stuff. I know in Philadelphia, we have a recipe club, we have a sports club, we have just anything. Typically what we do is we do various surveys in our meetups, and we'll ask caregivers, like, what are you interested in learning? What are you interested in doing? And we come up with a group. So that's specific to Philadelphia. So I really encourage you to reach out to your local VAs and see specifically what type of intervention groups and outings that they're offering specifically for caregivers. Next slide, please. As said before, the tenets of the general program is resource and referral, helping you navigate the VA system. The VA system is huge. As you saw through Gretchen's beautiful presentation, it's a large system, and my department is just here for you to call. Hey, Kellee, I don't really know what to go. This is what's going on. Could you please tell me where you think I should be, or could you help reach out to this particular team member for me? Our job within the CSP, the Caregiver Support Program, is to provide you support as you see fit. You know, and resource and referral and helping you navigate the system is a big one. Education, training, and support. As alluded in the previous slides, if you want to learn about it, if you reach out, we might already have it, but if not, we're very open to creating various outlets and or assisting you with finding the education that you need. And counseling, as I said before, a very underutilized service is the fact that you are eligible for counseling in connection with the treatment of a veteran. So particularly you guys as caregivers of folks diagnosed with Parkinsonian disorders, if anything is going on and you feel like you want to have that safe space to be able to talk to someone within our system, you are completely eligible for that. So please reach out to your local caregiver support teams and you can gain access to that wonderful, wonderfully underused benefit. Next slide, please. These are some of the other supports. We've discussed these in a couple other slides. Respite care services, as Gretchen mentioned earlier, within the VA, wonderful options of respite in home, within facility, outpatient. There are adult daycare. There are many different options of respite within our system. I encourage you to reach out to your PAC social work, that the social worker that works with your primary care provider, and just really talk to them what your respite needs are. It can be something, hey, I have a doctor's appointment once a month that I need to get to. Or it can be something, you know, we have a graduation and unfortunately the veteran doesn't want to travel and I'm going to be out of town for 10 days. It can be something, it can be any extreme. Please reach out to your social workers within your facilities to know exactly what is offered in your area. Next slide, please. So if you want to access any of the information that we've discussed today, that www.caregiverva.gov is a wonderful website. It has all the information in regards to the services and benefits that we offer, but also a lot of connections with other caregivers and just various evidence-based models of information. We also have a caregiver support line. They're available from 8 a.m. to 9 p.m. You can call that number. You will speak with a clinical social worker who will be able to listen and provide you with the resources and referrals to assist with the issue or concern that you're presenting with that day, or just be able to talk. Next slide, please. Thank you. And so this is another listing of all the information that we've discussed today. So thank you so much.
Thank you, Kellee and Gretchen. That was a lot of great material to have covered. And I know that we're starting to receive some questions. I encourage you to enter those through the chat. Kellee, I know you won't be able to stay on for our Q&A at the end, but if we do have questions that are specific to the CSP, we'll get those to you and try to get an answer out to folks following the program.
That sounds amazing. Thank you so much for having me today. And thank you guys for everything that you're doing in the caregiver and the care partner that you're doing with your families.
Thanks, Kellee.
Thanks so much, Kellee. Take care.
And we now have the pleasure of hearing from a care partner, Eileen Perigo. And Eileen is a caregiver to her husband, Craig, who is a veteran of the U.S. Navy, having served in Vietnam. They've been married 52 years, and Eileen's going to take over and tell us a little bit about how she and her husband have incorporated resources from both the Parkinson's Foundation and the VA on their Parkinson's journey. So welcome, Eileen. And you are on mute, Eileen, so let's.
Of course, I have to unmute. So I'm Eileen Perigo, as Kim said, and I want to thank Kim for organizing this, and also Gretchen and Kellee for all that comprehensive information about VA. There's so much out there. And then also to Danielle for her tech support. So it's just a wonderful group of people. And I hope that I can, share my story and my husband's story. So my husband, Craig, was diagnosed in 2015. And of course, we all as caregivers know exactly what happened when the diagnosis was given. So the first thing that I wanted to do was find out more information about Parkinson's. So I found the Parkinson's helpline, the 1-800-4PD-INFO immediately, and started gathering information. I wanted to be educated. I wanted to know more information about this disease that my husband had. So we found a neurologist here locally, and but she did not specialize in Parkinson's. So I went online to find out more information about I read about the Centers for Excellence with the Parkinson's Foundation. So I found in Gainesville, Florida, the University of Florida, our doctor, Dr. Michael Oken, who's absolutely wonderful. And when we went to the first visit, it was a very comprehensive visit. And one of the questions he asked was, were you in the military? And of course, my husband said yes. And he said, what a branch of the military and when? And he told him about Vietnam. So he said, well, if you were exposed to Agent Orange, you may be able to get some assistance through the VA. So it was the Parkinson's doctor at the University of Florida that told us initially about VA. So where do you get started? So I immediately went online and started with va.gov website and found that we had a local VA contact here. So I was pleased. And again, we live in Pensacola, Florida. So we made an appointment with the Veterans Administration Service Officer. He was so wonderful. I mean, our first visit, he told me what to bring. And we were with him about 2 hours. So I was just so pleased that, he was there to help us. So he referred us to a VA doctor, of course, and then the VA social worker who has been so helpful. She's been such an advocate. We've just about become personal friends, but anyway, so there's so much help out there. So then when I found out about the VA and Parkinson's Foundation, I wanted to get myself more involved, to learn more and to be on the cutting edge of what's happening with Parkinson's and the VA. So I participated in a Veterans and Parkinson's Disease Symposium in March 2021. And it was recorded. It's an excellent program. And so you can have access for it. Those of you who don't know about it, you can access the symposium at parkinson.org/veterans. And it's about a 2.5–3 hour presentation, but they had 3 groups of panelists. And the first group of panelists were medical doctors and healthcare professionals that discussed the medical care and treatment of Parkinson's. And then the second group of people discussed the mental health concerns. And then the third group of panelists was the veterans with Parkinson's in different stages. There were 3 different people with Parkinson's in different stages that were on that panel. So it was a wonderful program and you just learned so much from it. So I suggest that you go and take a look at that. So then the other way that I got involved, they talked a little bit about the Aware and Care kits. And these Aware and Care kits are free and it gives doctors and nurses a plan to get the best care possible in the hospital. So I just recently finished training with the Aware and Care kit and I became an ambassador. So there were 40 of us that were trained this year. The ambassador program is fairly new. And so what we do now, and I'm going to go out, my first group of people that I'm going to be talking to in the first of the year is veterans, of course. So I'm excited about that. We have several Navy bases here in the community, so I'll have easy access to talk to veterans. But I wanted to do a show and tell for the Aware and Care Parkinson's kit. So this is what it looks like. And on the back, it says Parkinson's Foundation. And it tells, who the kit belongs to and who the primary care physician is, and then who the Parkinson's doctor is. So I thought I'd open this and show you what the contents are. I mean, this was so helpful. And I should tell you, my husband recently, within the past month, had to go to the emergency room. And so I grabbed this kit, you know, when I was running out the door, and I was so glad I did. So one of the things that I put in there that I have, and some of you may already have this, but I just put a little sheet of my husband's meds and the time that he takes the meds, and then also the name of the doctor at the University of Florida. So they had this available right away from the ER doctor to the nurses. So then there's a Parkinson's bracelet, because as you know, the nursing shift changes. And so he's got this bracelet on the whole time. This is a little magnetic card that says that I need my Parkinson's medication on time every time, because you go into the hospital and you think that people are going to take care of you, and they do. But a lot of the nurses and doctors aren't as familiar with Parkinson's. So that's where this Aware and Care kit comes in. This is something for the wallet of the person with Parkinson's. It's a medical alert. There's a medication form. There's a fact sheet for nurses, a hospital action plan, and then the deep brain stimulation precautions if your loved one has that, and the duopa therapy precautions. So this is a wonderful kit, and I highly recommend that you go online and get it. It's free. There may be a charge for postage, but I wanted to let you know about that, because it really came in handy when my husband had to go into the emergency room. There's so many Parkinson's resources available. I wanted to hold up a couple, and again, these are all available online. This one is the medications, and this is just so important, because you don't want, in the Parkinson's Aware and Care kit, it talks about the different kind of medications that won't work with other medications. So you don't want your loved one to mess up the medications and have a contraindicated drug that is not going to mix well with their Parkinson's drugs. So I didn't have, you know, any bad experience with that at our recent hospital experience. And then there's a caring and coping guide. I think that Kim showed you a newer version. They update their materials all the time. So we have that. And then this last report, this is a Parkinson's report that I get, and it comes out a couple of times a year. In this last one, which was the fall winter 2021, it's called a care partner issue. And I found this really helpful. It just came in the mail just a week or so ago, and it talks about essential care partner resources in it. And it's just really helpful. So anyway, in closing, I just want to let you know that you're not alone. Sorry, but everybody has been so helpful to me as a caregiver and my husband through the VA and Parkinson's. So I just want to thank you and tell you that there's always help available. These people are fantastic. So, all right, Kim, I guess we can go to questions and answers now.
Thank you so much, Eileen.
Thanks, Eileen.
Thank you for all you do. So at this point, we will go to, pardon me, question and answer session. And we have got a number of questions that were submitted in advance that I will actually start with. And Gretchen, I'm going to go to you first. Is medical equipment such as a U-step walker for Parkinson's covered by the VA?
I can tell you, I can speak for my VA. Yes, we do offer them here in Philadelphia. I don't know if they're offered everywhere, but they might be able to get them for you if your physical, you would need to be evaluated by a physical therapist first to make sure that it's an appropriate piece of equipment. So your first step would be to talk to your VA primary care or your VA neurologist or Parkinson's specialist. Let them know that you're interested in being evaluated for a walker or U-step walker, and they'll put in a referral to the physical therapy unit to have an evaluation done, who will ultimately make the determination of what's the best device for you.
Okay, great. And then that medical equipment can be, if it's been ordered and they're eligible, they can get it through the VA then?
Yes. So
okay.
As long as you're registered again with the VA and receiving care at a VA, there's a wealth of durable medical equipment that's available as part of your benefit. There's no charge for it. I mean, walkers, wheelchairs, power wheelchairs, stair glides, button hooks, weighted utensils. A lot of the equipment, though, does require an evaluation with physical and occupational therapy, just because they want to make sure that they're getting you a device that's best for you and that you would be safe using. So when in doubt, I always say, ask your VA provider for an evaluation with rehab. If you buy it on your own first, the VA will not reimburse you for it. So ask first and try to get it through the VA. If it's not available, they'll let you know.
Okay, excellent. Thank you. So a question regarding somebody that says they are a Vietnam era veteran, been told that they are not eligible for benefits due to too high of a retirement income. Not being on disability, can they expect any VA support for their spouse?
So a spouse of a veteran would not be eligible for VA healthcare alone. You have to be a veteran. If you aren't service connected or have a service connected injury or illness, there is an income requirement, that a threshold that the VA has, and it's different and it changes often. So you would speak to eligibility to see what that income is. If you are denied and your income changes at some point, reapply. Again, the income guidelines do change over time. The threshold does change, but there are some veterans who may not be eligible because their income is over a certain amount, unfortunately.
Thank you. I'm kind of switching gears, and I'll ask Eileen if she wants to weigh in on this as well. Talking about the veteran and possibly experiencing some cognitive decline, how do we properly factor in the decision-making ability of the veteran as a care partner, and is there a way to engage any of the VA care team, and maybe elaborate for us about what the VA care team is comprised of? And Gretchen, I'll give that to you and then see if Eileen would like to weigh in as well.
Sure.
So if you have concerns about your spouse's cognition or memory, definitely bring it up to your movement disorder specialist. If you're within the PADRECC system, most PADRECCs have a neuropsychologist affiliated with the team who could do further neuropsych testing to see exactly what the level of impairment may be, and then make recommendations from there. Again, there's social workers that are available that can provide some support to the care partners, and just talking about different strategies that may help in coping with memory impairment for the person with Parkinson's as well as the care partner. So, there is a team available. The consortium sites may not have access to the neuropsych testing, but we may be able, they may still ask them about it. They might be able to refer through their local medical center, and they may have resources available, or could possibly send you outside for it through VA community care. So when in doubt, bring it up to your doctor and talk about it.
Okay, and Eileen, would you like to share?
Sure. Yes, I have to make sure I'm not on mute. So anyway, my husband was recently diagnosed with mild dementia, and he went through a cognitive assessment at the University of Florida. It took about 4 hours. He was just so exhausted after. And so we did realize that he does have mild dementia. So since this is real recent, I haven't gone to the VA, but of course I will, and see what help may be available. So, and as far as a caregiver, I think that listening to the person who has Parkinson's is really important. And even though I may have to, he might ask me the same question 4 or 5 times, I answer it as if he was asking it to me for the first time. So I think that you just have to be respectful and patient, with him. And so, that's what I've experienced so far, but I haven't taken the next step to look into what VA has to offer for that mild dementia.
And I'd just like to add that the caregiver support program, that general program, it does have a lot of resources and training and groups for people with cognitive impairment and dementia. So it may not be specifically for a person with Parkinson's who has impairment, but it's still cognitive impairment and dementia and learning to cope with it, skills training, meeting with other people who are, going through something similar. So there, definitely tap into your caregiver support team at your local VA.
Thank you. I will. Thank you.
And Gretchen, in your presentation, you talked about some of the PADRECC offered virtual support groups. Well, and some are in person, some are virtual. If somebody doesn't live within access physically to one of those, how can they find out about perhaps participating virtually in a support group for Parkinson's?
So you can, if you go to our For Veterans and Families page on our website, which I have listed in the slides and is also in the FAQ document, you will see a list of the groups as well as a contact for the facilitator of the group that you can reach out to.
Okay, that's excellent.
Oftentimes it doesn't matter where you live since they're virtual right now. That's one of the beauties of virtual groups.
Yeah, and just tying it back to what Eileen said, that you're never alone. And we know that these support groups can really be a lifeline to care partners. So encourage everyone to check that out. I will note we'll be following up with a document to all of our participants today with some of these resources and the specific links, how to get engaged with the resources we've discussed. Another question for you, Gretchen. My family has the experience of getting a runaround when advocating for VA in-home benefits for Dad, who is an elder veteran with Parkinson's. Any suggestions for?
You would really need to access that through your dad's social worker through their primary care team. That would be your best contact. Now, there are eligibility criteria. So, and again, that can be different from each VA. So if he doesn't meet the eligibility criteria, he may not be eligible yet. So I can't speak to your dad's specific case, but I would say, definitely connect with the social worker within the program, your primary care team, who should be able to help assist you or at least explain what the program criteria is.
Excellent. A question on veterans care. How does the veteran get reevaluated as the disease progresses? Is that something you could speak to?
So I'm going to guess that this might have something to do with the service-connected rating. So if you're initially service-connected and you're pretty independent and mildly affected by Parkinson's, your rating might be lower. As your disease progresses, you can submit a reevaluation through veteran benefits, which is, I can blurt out the number, 1-800-827-1000. You can ask them to reevaluate your claim. If it's found that you have progressed through your medical records and documentation from your neurologist, that percentage may increase over time. I do always caution that there is a chance that it could, if you improved and they reevaluate you, your percentage could go down, but in most cases it's because the disease has progressed. So, and you can also connect with your local veteran service officer, which you can find in your county offices of Veteran Affairs. And there's also a link in the FAQ that has a way for you to find your local veteran service officers who can help with the claim process.
Excellent. And let me ask Eileen also to maybe share with your own navigating of VA services, maybe any tips or strategies that worked for you and Craig in your journey?
Yes, I think having a positive attitude and then just being respectful of those people who are there to help you and being patient with the process. So I had, the Veteran Services Officer was our first point of contact, and he was incredible. And, actually started faxing things, while we were there, his DD-214 and all the other, information that we brought with us. The social worker, our social worker, and she's also an LCSW like you, and she was just so helpful and, check back with me periodically. Did you get everything you needed? Is there something else I can do for you? So I really think that connecting with the social worker and making time for that person is very important, because you're going to need that person throughout the progression of your loved one's Parkinson's. It's just a good idea to do that. And that's what we learned, just being friendly and thankful and grateful for everything that they do.
Wonderful. Thank you, Eileen. Gretchen, a question regarding in-home modifications. So we all know, aging at home is certainly most folks' goal. What does the VA offer in that respect?
So again, there's a lot of medical equipment to help modify the home. Grab bars can be ordered and installed by the VA. Again, they would, sometimes you might have to be evaluated by a physical or occupational therapist. They may send somebody, they usually send a contractor out to your home to make sure that the grab bars can be safely installed. Stair glides, if stairs become an issue, that's something that could be available. Sometimes railings and ramping. If it's a big structural improvement that needs to be done, like widening doorways so that a wheelchair could fit through, or removing a step-in tub with a more walk-in shower. There are some grants available. There are a one-time lifetime grant. One's called the Home and Structural Improvement Grant. Again, connect with your social worker at the VA, connect with your rehab team at your VA. Those are really the people who will help assess what the needs are, what grants, if that grant's appropriate for you, and help you through the process.
Great. I know you mentioned, touched on this in your presentation, Gretchen, but if the co-practice aspect, if my veteran has Medicare, can I still use the VA? How does it affect our insurance? This is a frequent question we hear.
So we encourage our veterans to continue carrying their Medicare, especially Medicare A. That's your hospitalization. If you call 911, they're going to bring you to your closest hospital, not to the VA. So you want to make sure that you have some type of private insurance still that would cover that. If you have an HMO type plan, the VA may be able to bill that HMO for part of your visit, so that might decrease your copay. If you have a copay through the VA, it doesn't affect your eligibility. I guess my bottom line is it doesn't affect your eligibility for VA healthcare if you have private insurance. And it's good to have a private insurance, because if the VA doesn't cover everything, at least it can act as your secondary.
Okay, great. And then reiterating that you can continue to see your community neurologist, correct? Even if using some of the other VA benefits.
Yeah, we do that a lot with Pennsylvania Hospital and Jefferson Movement Disorder Center. We have veterans who've been seeing their neurologist in the community for a long time come to us just to be able to get the discounted prescriptions, $8 to $9 supply of medication. But we can do Botox injections there if that's something that you need, and it might be more cost effective to do that. The durable medical equipment, if you need the in-home help and that's something that you're eligible for, as long as you go to the VA one time a year, you can maintain the VA benefits and continue to see your community neurologist. That neurologist would just be the person in charge of making treatment decisions. So the VA neurologist would communicate, would tell you what their recommendations are. You would either talk to them or the VA doc, and then the community neurologist could have a conversation about what the treatment suggestions might be. It ultimately is the neurologist you appoint as your director of care. Does that make sense?
Yeah, and I wonder, Eileen, do you have anything to add to that?
Yeah.
No, I think you did a great job, Gretchen, because you know all the facts and all the data that's associated with VA. No, I don't have anything to add. Thank you.
Gretchen, a question too about, and kind of ties to telehealth. Does the VA help at all with adaptive technology, computer equipment, et cetera?
So if a veteran doesn't have a mobile device that has a camera or have a laptop of any kind and needs to do telehealth care, they may be able to obtain that an iPad through the VA. Again, they'd have to go through their VA primary care provider, who would put a consult in, and it would be evaluated to determine, and it's a loan device, so it's not yours to keep, but the primary purpose is to be able to do your telehealth care. So that might be a possibility. You would have to have some type of access to, like if you're in a really rural area and internet access is spotty or difficult, it still may not work. But if you have reliable Wi-Fi access, which should be able to work.
Thank you. And I'm going to give a last question to Eileen, and then Gretchen, any other closing thoughts that you want to address. But Eileen, I wanted to see if you could share, I know during our registration, we had care partners sharing some of their own tips on being a care partner, a good care partner. I wanted to see if you would kind of touch on a couple of those from your own perspective.
Sure. And I actually, I had talked about listening is really important. And with my husband and I being married for 52 years, and then of course with recent COVID, I feel like we've been joined at the hip. So I just know his every move, his nonverbal expressions and everything. And he might not be feeling well, and I'll look over and say, "Are you feeling okay?" "Well, I don't feel real good, right now." "Well, why don't you go lie down?" And then just be really in tune to his needs. I think that that's really important, be in tune. And, and the other thing that I would recommend is, and we do this a lot, we're very active, we're very physically active. And so my husband and I walk at least 10,000 steps a day. And he's adamant about getting that. I mean, you should see him. If he only has 9,800 and it's nighttime, he's going to walk around the house for 200 more steps. So he's really adamant about it. But and we do fun things together. I mean, we'll go out to the neighboring city. It's a fun city to go to, and we'll spend the day over there, and we'll eat over there, and we just have fun together. So I think having those outings, if the person with Parkinson's is able, go out and just have fun in the middle of the day, just go do something fun. And we try to do that. We have a lot of friends. We're blessed to have a lot of friends here, and they'll call us and, "Hey, let's go out to eat," or "Let's go do this." And, so we do that. So I think those things is what I would say we do, and just make life fun.
Thanks for that. And I know that, fitness opportunities, and we didn't touch a lot on that, but I know, Gretchen, do you recommend the physical therapist really as the first line making recommendations about, the walking or exercise that's so important?
Yeah, I mean, that's available through the VA as well, and they can help put together an exercise program for you. We don't offer like rock steady boxing or dance with PD, but we know our community programs that do offer it, and we recommend that our patients do take advantage of those within the community. VAs may be able to provide the LSVT big and loud program. You would just have to check with your specific VA to see if they offer it. If they don't, since that's considered more of a medical treatment, a rehab treatment, it may be able to be covered through the VA under VA community care. So definitely inquire about it at your VA to see if it's available, and they'll let you know if it is or if it isn't. So when in doubt, ask.
Right. And keep everybody moving to the degree that we all can. So
Absolutely.
Wonderful. Gretchen, anything else to add before I kind of wrap things up?
I just like to thank all the care partners who joined today and for the care that you provide. And just as Kim has said, and Eileen has said, you're not alone. There's a lot of resources and services available within the community through Parkinson's Foundation and through the VA. And I hope that you take advantage of them. For all our veterans who may be on the call, if you have any questions, like you can call our hotline number to ask about eligibility questions. We can't determine your eligibility, but we can at least point you in the right direction to find out how to apply for VA care and answer maybe some of the questions that you may have. So don't hesitate to ask. That's what we're here for. And we just want to make sure that you're getting the care that you're entitled to and what would be best for all of you. And take advantage of the caregiver support services through the VA if you're already connected. It's a really great program. It's really expanded greatly over the years. They have a lot of wonderful resources available. So I just encourage you to take advantage.
Well, I hope that we have all learned a lot today. I know that I have. This does conclude our presentation. I really want to thank our fantastic speakers, Gretchen, Glenn, Kellee Taylor, and Eileen Perigo, for lending your expertise. And of course, the thank you to all of you for joining us today. A reminder that the presentations were recorded. We'll send out a link to that video in approximately a week, although recognizing next week is Thanksgiving. We want to note if your question was not answered or if you're in need of support, excuse me, please do call our helpline or refer to the frequently asked questions guide that you'll find at parkinson.org/veterans. We'll also send that out in our follow-up document. Please know we also offer virtual programs every week through our PD Health at Home program. And you can visit parkinson.org/PD Health for a full schedule of those programs. And before you go, please know that we'll be offering a survey for you to share feedback about today's program. This is always important to us so that we can continue to offer the programs that our community needs most. So please feel free to share any and all feedback with us as we make those programs meet your needs. Again, thank you all for your participation today. Thank you all our veterans for your service to our country. And we wish you all a wonderful Thanksgiving. Take care.
Thank you, everyone. Thanks for having us. Thanks, Eileen and Kim.
Thank you.
Take care.